Hello, all my FMG doctor friends who are getting ready for 2025 exam. I know you guys must be revising so much, and this time definitely only revising. No any new topics, new studies, nothing. Just stick to the revision. So I have made this 150 one-liner, which is very, very important, very easy to remember also and important for your exam and also especially for doctors who don't have time, who are like, sir, I don't have time for my chrono revision, how to do it, for them to complete it very quickly in few hours just to finish this subject and be happy before going to the exam so that you'll improve your score also. Definitely there are a few things you would have studied, but without revision you might forgot it. So those things I'm going to bring it very fastly and easy way. So let's start the topic now. So see the one-liners. So when it come for polypeptide capsule McFadden reactions, you already know it. Okay, when you talk about polypeptide capsule, that means it is basically the amino acids. Amino acid. And McFadden, I always say Maddie. Maddie's girlfriend. Maddie's Madhavan. Girlfriend is Andrea. Andrea, right? We had a big story on that. Okay, Andrea. So I meant to say here the disease is anthrax. The disease is anthrax. So basically, you will get in option Bacillus anthracis. Bacillus anthracis. Okay, Bacillus anthracis. So you will easily mark this question. No any mistake in that. McFadden reaction is basically at a methylene blue and the capsule becomes purple color. That's okay. That's not important. Polypeptide. So this is the only polypeptide capsule and which has McFadden reaction positive is only Bacillus anthracis. The rest all of the polysaccharide. Endotoxin. Endo means I always say remember the introvert people who always remain inside the house. So the people who always remains inside the house or what they are negative. First of all, they will be very negative. Second one, they are fatty. They will be fatty and negative. And because they're inside the house, there will be heat stable because they don't go outside. No, so what I mean to say, endotoxins are produced by gram negative. When I say fatty, it means lipid, right? Fat means lipid. So it is produced by which layer? LPS layer. LPS basically the lipopolysaccharide layer. Lipopolysaccharide layer. Okay, we frequently asked question. And of course, they are endotoxins are usually heat stable because they are inside the house. Introvert people always say endo means inside house. So heat labile. They're heat stable. They not get affected by heat. But this is quite opposite to your exotoxin. We're not talking about that. Yeah. So you will know it. So now decreased protein synthesis, DPS. DPS, you already have a clue, DPS, right? Decreased protein synthesis. So D for diphtheria. And there's already clue the P for pseudomonas, right? Pseudomonas. And S for your Shigella. So we always say for diphtheria pseudomonas, the mechanism is same. What mechanism? They both inhibits the EF2 factor, elongation factor, decrease the protein synthesis. Shigella, I always say Shigella auntie. Auntie is how much year old? 60 years old. She's 60 years. So remember, she inhibits the 60S unit of your 60S unit of a 6 for 60, right? 60, Sheila 60. Okay, 60th unit of your ribosome. That's all. Very simple. Cyclic AMP mechanism. Again, there's already clue there. CAMP. So C for your cholera. C for cholera, that is your Vibrio cholera toxin, and A for a toxin, all are toxins. A for your anthrax toxin, Bacillus anthrax toxin, and M for M tilted, so it becomes E. coli, right? M you make like this becomes E. So E. coli, especially which we are talking about A. A is anxious. No, when someone is anxious, what happens? They are very labile. They become labile, not stable. Good people are stable. Anxious people are labile. So this is basically the labile toxin. The labile toxin, heat labile, yeah. Heat labile toxin, moderated heat labile toxin, okay, of E. coli. And P for pertussis. You can whoever you revision, you can just, when I'm saying, you also speak with yourself, okay, so it will make like a revision for you. Now tetanus toxin, that is your the toxin is tetanospasmin. What does it do? It usually inhibits the GABA and glycine. Very important. GABA and glycine, those are the inhibitory mediators. Okay, this is very important. You have to know these are inhibitory. That's what we have. What? Spasm. Inhibitory is gone, so there'll be more stimulation. So this is okay. But you talk about the botulinum toxin. For Clostridium botulinum, that is the botulinum toxin. Botulinum toxin, it inhibits it's stimulatory acetylcholine. So when stimulatory is gone, it will become all becomes flaccid paralysis, right? Flaccid. Here it is spastic. So this thing leads to spastic paralysis. Okay, that's all. Now, darting and shooting. Darting and star. Whenever you hear the darting and star, I always say, remember darling. Darling and who is this darling and star girl? Darling and star girl is our Vibha. Vibha means Vibrio cholera. Okay, this you know very well. You know this very well. For students who don't know, it's okay. Now it's a time to know. Okay, Vibrio cholera. The Campylobacter jejuni also. Okay, Campylobacter jejuni also. You remember Vibha likes to do Camping. So Campylobacter also gives a darting motility. Don't forget, okay? Viva likes this thing. That's what. Tumbling on difference. Tumbling on difference, you know that. I always say one guy, this guy name, he's having a big tummy list. I call him Mr. Tummy list lister. Okay, I call him tummy lister. So because listeria monocytogenes is the answer. So this is a differential motility also and also tumbling motility. Okay, both for listeria only, monocytogenes. This is the only gram, this is one of the gram positive bacteria that causing neonatal meningitis. Okay, not going too much there. Now swarming motility. Swarming, I know who loves to swim. Prochita and V paru. I said Prochita and V paru, V para or paru with the T. With T, they like to swim. They like to swim. Okay, swim. So these are three bacteria. One is your Proteus. Especially Proteus is very, very important. Frequently asked, but nowadays you don't know. Vibrio parahemolyticus is frequently asked question. So just to be careful. Okay, parahemolyticus. Vibrio parahemolyticus. And of course T because Clostridium tetani also gives the swarming motility. Tetani. Okay, that's it. Okay, 1% sulfuric acid. 1% sulfuric acid. This is very interesting one. You know that in acid fast, during the acid fast staining, or Zeal-Nielsen staining, we usually use 25% for which one? Your Mycobacterium tuberculosis. And 5% is for 5 letters. No, so LEPRE, 5 letters. That is your Mycobacterium leprae. Okay. Also, this is called fight for ACA. They call it as fight for ACA technique. Fight for ACA technique. Okay, that also can be used. But 1% where it is 1% used in nocardia. One is your nocardia. Other one, some important acid fast parasites. Okay, what are the important acid fast parasites? Cryptosporidium. They are the most common cause of HIV diarrheas. Okay, HIV diarrhea, HIV patient diarrhea, cyclospora and cystoisospora. Okay, all CCCs. Okay, so these all are acid fast parasites we call. Also, don't forget your this hooklets of hydatid. Hydatids hooklets also an important role, and Tinea saginata segment. Tinea saginata segment. Okay, Tinea saginata segment. Okay, that's all. Now, next. Log, you know that this is a bacterial growth phase. In bacterial growth curve, if you see, the growth curve is very simple. It's like this and this. Yeah, so the one phase, the first one is your lag phase, this is your log phase or exponential, and this is your stationary, and decline is not important. Now, yeah, before going to this log phase, in lag phase, you know, maximum size. In lag phase, what happened? Bacteria is a maximum size. That also can be. That means it's a lag phase is like a vacation. Lag, you're lazy. Before college, you do this thing. When you talk log or exponential phase, you remember your college. It's your college phase, active phase. So what happened? Automatically in college, the size decreases because multiplication of bacteria increases. Multiplication, the bacteria size decrease and multiplication increase. Okay, I'm talking about bacteria here. Okay, so, but you remember, like you're getting fit and your size is decreasing. You want to become slim fit to, to get more girls or to get more boys, okay, whatever. Okay, so accordingly you do. Now what happened here in this phase, so it's in a college, so what you'll be doing in college means biochemical test. So this is the best phase to do biochemical staining methods, biochemicals and staining methods. Okay, these are very, very important also for your antibiotic sensitivity testing, antibiotic testing. Okay, there's two different things. Antibiotic testing you can do it. So biochemical staining, all in college only you'll do these things. So this phase, okay, it's important. They can ask you a question. What about the stationary phase? In stationary phase, you already have a clue that STAT. T, you make it as a B. Okay, like this. So S for spore formation, you know, repeatedly, very important, repeatedly asked. T for toxin, antitoxin. Toxin and antitoxin mechanisms. When you talk about toxin, we are talking about the different type, not only antitoxin, transitoxin mechanism. Here, what happened? Most of the toxins, exotoxins productions are happening here only. Okay, especially exotoxin productions are happening. So that's basically toxins. So exotoxin productions are happening, toxin, antitoxin mechanism, everything is happening here only. And what about A? A for antibiotic production. Even the bacteria produces own antibiotics. Okay, not the antibiotic testing, that's different. That is the testing. But here we're talking about antibiotic bacteria producing itself. Okay, and even the bacteriocin. So these are things produced: toxins, spores, and then anti and B. That's what we give. STAB. Okay. Yes, that's all. Okay, fine. Next. So the shortcut is tab for stationary phase. You'll not forget. Okay. Now next. Lysogenic conversion. Lysogenic conversion unit is one genetic mechanism where bacteria occurs thing. So like some bacteria acquires a virulent thing only by through this, right? So how they go? The shortcut is, remember, is VIBAS. Scarlet bed. Vibha has a scarlet color bed. Okay, she has scarlet color bed. So V for again Vibrio cholera, Vibrio cholera. Scarlet fever. Scarlet fever means is the strawberry tongue, and that is caused by which one? Your Streptococcus pyogenes. Streptococcus pyogenes. Yeah, pyogenes. B for Clostridium botulinum. Clostridium botulinum. Botulinum. So botulinum toxin. I'm talking everything about the toxins. Okay, how the toxins become virulent here. Okay, Streptococcus pyogen toxin, scarlet fever toxin, E. coli toxin, toxin. D for diphtheria. Diphtheria is frequently asked. Diphtheria toxin also. Okay. Diphtheria toxin. So diphtheria cholera frequently asked. Okay. Even one more thing, Shigella also. Remember Shigella. S for scarlet. S for Shigella also. Shigella toxins. Okay. So these are lysogenic conversion bacteria. It's very important. They can ask. And fluorescent stain, you know already. I'm going to write it very fast. Auramine. And rhodamine. Auramine and rhodamine, very frequently asked question. Last time also, the fluorescent stain for some bacteria. And then, of course, you have calcofluor white. Calcofluor white, calcofluor white, calcofluor white. You already have a clue there. F. And then acridine orange. Acridine orange, acridine orange. You have, okay, orange. You have to give orange to someone. So now you know that auramine, rhodamine, M for M. So Mycobacterium tuberculosis for Mycobacterium TB. We are using the stain. And calcofluoride have for fungi. And if you remember, all the fungi are mostly white color, especially the yeast one. So like that also. And who you will give orange to which patients? Malaria patients. So malaria means plasmodium. Give orange to malaria patients. Okay, plasmodium. Very, very simple. Now the selective media. When you talk about the selective media, you know the best media for TB is LJ media, Lowenstein-Jensen's media, LJ media. Okay, the Lowenstein-Jensen's media asked frequent asked question. Cornebatum diphtheria, it is usually potassium. Tellurite agar. I told you to remember because whenever there is a diphtheria outbreak, tell the interns not to loaf around. Loaf, I'll tell. Loaf is enriched media, but tellurite, potassium tellurite, blood agar is a selective media, BA. Okay, so we also call this KTBA, potassium tellurite, blood agar. Okay, so don't forget. Tellurite word is important. Selective media. Neisseria, I always say this clue to the students. Please remember like this. Nissa's boyfriend is where? He's in New York, and his name is called Martin, Thayer Martin. Okay, Martin. Okay, Thayer Martin. So it's basically the New York's media. Even if you forget also N is there, New York, modified New York's media, and the boyfriend name is Thayer Martin. Thayer Martin's media, Thayer Martin media, Thayer Martin's media. Okay, not to confuse, very simple. Okay, now Shigala and Salmana. Shigala Salmana, it is Salman and Sheila, boyfriend, girlfriends. Okay, they have the Sheila auntie and Salman, they usually have. I'm going to write here. Sheila and Salman, they share most of the things. Salman. One is your DCA media, XLD media, deoxycholate agar, XL xylose lysine deficient agar, and then one more is your xylose lactose agar, okay, lactose agar, deoxycholate agar, and then your SS agar. But for Salmonella, Salman has his own body called, his name is Wilson. Wilson Blair. Only for Salman. Only for Salman. Only Salman. Only Salman. Okay, not for Sheila. Only for Salman. Salmonella. Okay, Wilson Blair's media. Wilson Blair media. That is also a question frequently asked. So Vibrio color. I always told you to remember. Vibha who works where? She works in TCS company. She is an IT girl. She works in TCS company. So what do I mean by that TCS company? So TCB, you add TCBS. Okay, that's it. TCBS. Thiosulfate citrate, bile salt agar. Sulfate, citrate, bile, salt, agar. Okay, bile, salt, agar. Very simple. So, you not forget. TCS company, remember? Easily you'll remember. That's it. Okay. Mycoplasma. Mycoplasma, I always told you to remember Diana, because you have Diane's method. We'll talk about later. Diane's method. So, Diana, she's what? She's a people's queen, and also she loves to eat. She eats fried egg. Her favorite is fried egg. Okay, fried egg. So why I'm saying this? Because the other name of this is also called PPLO agent, and the agar is the media, also same name, or you call it as eaten agar. Eat, she loves to eat. Diana likes to eat. And mycoplasma, also remember, Diana's skin is like a cholesterol, very smooth, and it's gliding motility also. Okay, so gliding motility comes there, so that's what I want to stress there. Okay, so you remember like this, it's very simple. Okay, now transport media. Now transport, what do Vibha, how she Vibha, she has a driver name. She has a driver, driver is Venkatramanan, and she has a carry bag. She has a carry bag, and then also she takes what? Salt water. She drinks salt water while traveling. I don't know why. Okay, so driver, carry bag, this thing. So you already know, because Venkatramanan Ramakrishnan media, VR media, Venkatramanan Ramakrishnan media. I'm not going to write the full name because, okay, right. Venkat, I'll write. You can VNKAT. Venkat Ramakrishna media. Okay, you remember it. And K for carry layer media, carry bag. She carries Viva carries a beautiful carry bag on her back. And then salt water, it's autoclaved seawater, autoclaved seawater. So please remember, important question, definitely repeatedly asked. These two are frequently asked. So careful. Okay. Salmonella shigella again, frequently asked again. So what they do when salmon shigella, whenever they go out, they wear the socks. They wear socks while travel, they use socks. So the idea is Sachs buffered glycerol. Very simple. Sachs buffered. When they travel, they use Sachs buffered glycerol. Sachs buffered glycerol. Okay. Now, Neisseria gonorrhea. Neisseria gonorrhea, for Neisseria meningitis, you no need transport medium, but for gonorrhea, we need its urethral discharge should be transported. So, how do you transport? Usually, we told that for Nisha, boyfriend is in New York. So, what she do? She starts aiming to go New York. She starts aim to go New York to meet his boyfriend. So when it says starts and aims, Stroud's media and Emmy's media. Stroud's and Emmy's media. That's it. Stroud's and Emmy's media. Ames, Emmy. How you want to remember. Okay. That's all. Very simple. Now enrichment media. Now in enrichment is basically to make the bacteria grow well and commensals will be inhibited. So for conservative diphtheria, I already told, tell the interns not to loaf around. I tell whenever tell the interns not to loaf around during diphtheria outbreak. So loaf because loafless media, it's very have for fast. That means you have growth within 8 hours, 6 to 8 hours you will have the growth. But in your potassium telluride agar, you will have 48 hours long. Okay, long name, long. Your loafless short time and you have for fast, so within 8 hours. Enrichment media. Repeatedly asked question, don't forget. Okay, tell interns not to loaf around. Okay, in diphtheria outbreak. Okay, Vibrio cholera. Vibrio cholera, enrichment means her favorite drink to look good energy is she takes alkaline peptone water. Alkaline seawater for traveling, for alkaline peptone water is for enrichment. Alkaline peptone water. Okay, very, very important. Yes, alkaline peptone water is common. Okay, next. Salmonella and Shigella for both the common, that is Salmon and Sheila, both for enrichment, what they do, they drink broth. Both of them drink Salman and Sheila Auntie, they drink broth. Okay, what broth? They drink the selenite, uh, selenite, Hef broth, selenite, Hef broth, or thiosulfate. Sorry, excuse me. Selenite, and other one is your tetrathionate. Okay, tetrathionate, Hef broth. Basically broth. Okay, basically they are broth. Okay, that's all broth. That only you want to remember. Okay, but basically you remember as a broth. It will be easy to remember. Okay, now hotter oven is temperature. So hotter oven, we know that shortcut whenever hot oven comes, remember glassy, liquidy, or oily. Okay, oily or liquidy meaning same. Anything dusty or powdery. Okay, they are same. And then any sharpie. Okay, that's all. So you already have clue for this, and you already know this. All the glassware you can put it in the hot air oven, and liquid paraffin or oil paraffin, whatever. Okay, anything oily, liquidy. Okay, and then dusting powder is usually we use in the gloves also. No, so those not the gloves itself, the dusting powder only, not the gloves. Gloves is a plastic, it will go in autoclave. Sharp instruments, any sharp surgical instruments. Okay, this meant go ahead. Temperature, you know very well, 160 degrees Celsius for 1 to 2 hours, 1 or 2, depend upon the need. Okay, that's all. Now, autoclave instrument, for autoclave instrument, you know that usually we use here non-sharp surgical instrument, one thing. Another one is all the plastics and rubber, any plastic and rubber. Recently, if you remember, they told pipette, the plastic pipette where you will put pipette, catheter, any plastic you see, any plastic your things, it will go in autoclave only. You have to autoclave it. Okay, because you put in hot air, it will burn, no? So you have to put it here. Any plastic rubber material, all the culture medias, most of the culture medias. We do autoclave only. Okay, temperature you know very well, 121 degrees Celsius, 15 minutes, and 15 pressure. PSC, pressure. Okay, that's it. This is also characteristic, you know it. Insufficient sterilization, yes, only the temperature difference is very, very important. Very easy also. For both are intermittent. Both are intermittent only. Common is both are, I'm going to write here. Both are intermittent heating. So 3 consecutive days. 3 days you have to heat. But insufficient temperature differs. For inspiration, it is 85 to 88 degrees Celsius. Usually 85, you can remember, that's fine. For tinderization, remember tin is 10, no? 10 and tin. Okay. 10 into 10. 10 into 10 is equal to 100 degrees Celsius. So you boil it, heat it for 100 degree. Here, 85 to 88 degree only. Okay. Then 100 degrees. So tin, because tin of sugar. Remember, tin of sugar. So sugar containing media. Sugar containing medias. Sugar containing medias. Biochemicals which contain sugar, you're going to sterilize it. Here, in speciation, double S is there. So double S there means what? You remember LSS media. LSS media. So LSS comes and LJ also comes. LSS for diphtheria, low flow serum slope, right? Low flow serum slope. Diphtheria and for TB. So these things are sterilized by this method. That's all. Very simple. Okay. Here, sugar containing media sterilized. Here, this is sterilized. That's all. Very, very easy. Spalding critical, yes. Spalding classification, critical and non-critical instrument. Critical, these days they're asking this question. The critical instrument means any implant. That means you use high level disinfectant, no, for critical. So usually it's the implant or any surgery instrument that is going into a cavity. Surgery instrument into body cavities. Anything into body cavity. So they all will be these things will be critical instrument, very critical, and you use the high level. Okay, examples of these things. Okay, surgical body. What about this one? When you talk about the semi-critical, you remember M is there, semi. So anything going into the mucosa. So for this, you don't need to use high level also you can use, but you can use intermediate level also is enough. Okay. High or intermediate level of disinfectant is enough. Mucosa means basically we're talking here endoscopes. All the endoscopes which is touching the mucosa, it will become the semi-critical. Whereas your implant surgical instrument enter into cavity, they become critical. Just this point you remember. Okay, fine. Now glutarolate. Glutarolate and all very easy. You know that it's a 2% SIDAC solution for all endoscopes. All endoscopes. But one thing, yes, exception is there for arthroscope, for the arthro and urethroskop. For arthroscope and urethroskop, you can use glutarate, but the best is, if they ask the best, then that would be your plasma sterilization. Best is plasma. Best is plasma sterilization. Steroid we call. Okay, fine. Ethylene oxide. Ethylene oxide, I always say, in Eti comes, this girl, Eti is a ICU doctor. I told her, Eti is a ICU doctor, my friend. She's a ICU doctor. So that means what are the instruments she will be sterilizing? Of course, definitely it is mostly your respirator, heart-lung machine, repeatedly asked question. So that's what I'm writing these things here. And one is your dental instrument. Okay, dental equipment. Very simple. Okay, respirator, lung machine, ICU doctor. So she works with these things. So these will be in ICU only, na, respirator, heart, lung machine. So remember like that, very easy. Plasma sterilization. For plasma sterilization, you know this. And yes, please remember, ethylene is usually called as a gas. This is called as a gas sterilization. Okay, gas sterilization. Plasma is plasma sterilization only. That's what sometimes you call it as sterrad, they call. Okay, sterrad, they call. And here, here we are using which one? Using the H2O gas. H2O2 gas we are using in plasma sterilization. Yeah. And then we just told that when plasma sterilization comes, the main thing which you remember is your arthroscope, and your urethroskop. Okay, please remember H2O2 gas. We use H2O2 gas, but we don't cause gas sterilization. Gas sterilization is ethylene oxide is properly gas sterilization. Plasma means H2O2 gas. We're using arthroscope and urethroskop. That's all. Okay, fine. Now, biological indicators, very, very important and easy to remember. I'll tell you how to remember. You will not forget it. Autoclave plasma, this is this is sort of steam, right? This is a steam. Plasma is plasma, very similar. So what the organism is Bacillus Stero is like a steam, no? Stereothermophilus. Stereothermophilus for both. Okay. Thermophilus. Frequently asked question. So please remember. Hot air oven. Hot air oven, I always say, in a cold weather, what you like? You like to have a hot tea and you like to have a hot sabji with what? Sabji with roti. Atta roti, right? Everyone likes atta roti. So don't forget. Okay. Tea, sabji, roti. So basically, Clostridium tetani. Some year they are in Fmge they asked Clostridium tetani. Some years they asked this one sabji, that basically subtilis. Okay, subtilis. Sabji means subtilis. Atta roti because Bacillus atrophius. Sometimes they ask Bacillus atrophius also. Okay, all are possible. So hot, garam, garam. Garam, garam chai, garam, garam sabji, garam, garam atta roti. That's all. Very simple. Okay. Now, filtration. Filtration, everybody knows that everybody loves brew filter coffee only. Brew filter coffee is the best one. Yeah, brew filter coffee is the best one. So brew because Brewendi monas. Brewendi monas diminuta they call. You remember Brewendi monas diminuta, but you remember only the brew. Okay, the Brewendi monas. Okay, right. Uh, Brewendi monas. Okay, fine. Radiation. Radiation, I always say that only Puma shoes, they radiate like a very well. They radiate. Puma shoes are very good. They radiate very well. So, Pumilis, Bacillus Pumilis, okay, Pumilis, okay. Now, gas sterilization. Gas, again, that's what I'm saying. Again, I'm saying this is a Eti leaves gas here. Eti leaves gas. So, ethylene oxide, Eti leaves gas. So, why she leaves gas? Because she likes to make gobi. Her favorite is gobi sabji. She likes gobi sabji and atta roti. That's all. Atta roti, not the chai. She likes only gobi sabji and atta roti. Who? My friend Eti, the ICU doctor. Eti, ICU doc. Her favorite food is eating and she leaves gas. Always she leaves the gas. Okay, remember like that. So gobi because this is Bacillus globigi. Okay, globigi. Okay, globigi. This is what asked in your last FMG exam. You know that. And this one is your Bacillus subtilis ataroti bacillus atrophius. So here no Clostridium tetanus will not come here. Instead, you will have globigi. Okay. So these are commonly asked questions, so not to forget. Now, next question, bamboo stick appearance. Very, very important. And gram stain, when you see a bamboo stick appearance, you know it will be like this. Central spore like this, no. And I told you always, remember which girl? Andrea is this pretty girl who's wearing beautiful necklace, and then she's holding one hand bamboo and one hand inverted fir tree. So you already got the clue what I'm talking. So this is basically the Bacillus anthracis. Bacillus anthrax. Bamboo sticks is Bacillus anthracis. Boxcar, I told who owns the boxcar? Boxcar only the rich, our Nagarjun. Nagarjun is the rich guy who owns the Naga means Negler reaction. You all know that Nagarjun is Negler reaction. So here boxcar Naga means who is he is Mr. Perfect. No, it's Naga Mr. Perfect. Naga Mr. We have another name, Nagarjun, the actor. He is Mr. Perfect. He is Mr. Perfect. Okay. So Mr. Perfect. So Clostridium perfringens. Okay, Mr. Perfect. I'll make it clear so you guys can remember it. Okay, Mr. Negler. Who is Mr. Negler? Negler is Nagarjun, Negler. So he's Mr. Perfect. So, perfringens, okay, easy or Welchii we call. Now, Medusa head colony, pure-like reaction and invertebrate. That's what I told you. Remember that pretty girl, Andrea, the actress Andrea with her Medusa beautiful hair she has, and she wears this beautiful necklace, pearl necklace. On one hand, she's having the bamboo stick, right? On one hand, she's having the bamboo stick, on the other hand, she's having this inverted fir tree. She's having this inverted fir tree. Okay, so you already got the clue. Okay, so this all goes to the Bacillus anthracis. Anthracis. Okay, very, very important. Now, that is for the Medusa head Andrea story. Our actress Andrea is all her Medusa head and pearl and bamboo, everything in with a fir tree. What about the bisected pearl? Bisected pearl or mercury drop is usually, we say, boarding children. Boarding school, in boarding school children they get this. Okay, boarding children, whenever they get this oofing cough, they will be gifted this one. So when I say boarding school itself, you must have already got it. Boarding, this is basically what we're talking. Bordetella pertussis. Okay, Bordetella pertussis, very, very important. So two pearls. One pearl is for our Andrea anthrax. Another pearl is this one. Okay, the boarding school children get the bisected pearls. Okay, now Chinese fried, and of course you have thumbprint sign that will show. Gram stain thumbprint also comes in this one. We'll talk about it later. Chinese fried rice. You know, Chinese fried rice means reheated Chinese. Bacillus. Be serious. Yeah? We always say be serious when you use Chinese fried rice. So that is Bacillus cereus. And you know that here if it is cyclic AMP and cyclic GMP, two types, emetic and this thing. So cyclic AMP is which one? A is anal means you should go down, no? So diarrhea type. Okay, diarrhea type. And A for anal. Remember, it's anal. Diarrhea goes in anal. G for gala. Gala is basically your throat. So vomiting comes this type. Vomiting type. Okay, vomit type. Very, very simple. See, easy. You will not forget it. Chinese letter pattern repeatedly told. This is always your Corynebacterium diphtheria. Diphtheria means it's of Chinese people. You have to remember they have bad diphtheria. Okay, bad thing, very bad one. Okay, Chinese letter. Okay. Now in gram stain, if you have thumbprint appearance, I told what boarding school. Boarding school children, they play with what thumb. They put the aluminum paint, mercury drop. Okay, like this, they play with their thumbs. Okay, boarding school, boarding school. Just I told before. So that is basically your Bordetella pertussis, which is causing woofing cough, Bordetella pertussis. Okay, very simple. Okay, boarding school children, they play with the bisected pearl, aluminum paint, mercury paint, and with their thumb. Okay, so you got it. So thumb per Bordetella pertussis, very important, easy question. X-ray thumb appearance means we always told that who always makes his thumb up after winning the swimming. He is the guy. He is our he who in the Olympics, the swimmer. He's our Michael Phillip, right? Michael Phillip is basically hemophil. Phyllis, Michael Philip, Phil. Okay. Hemophilus. So that is Phil. So idea is Hemophilus influenza. Hemophilus influenzae. Okay, influenzae. So this is an important question. You know, X-ray thumbprint appearance. Okay, so two thumbprints are coming. That's what I made like this, so you'll not never forget. Now, Undulant, Malta, Mediterranean. Who is the guy who's traveling to Malta and all these places? It's our Bruce Lee, Uganda, Malta, the guy who is traveling frequently, which actor, which Chinese actor, I already gave you clue. So Chinese actor means is it the fighter is Bruce Lee. So it is Brucella. Okay, remember again, frequently asked question, you know it, Brucella. GBS is usually Guillain-Barré syndrome. Guillain-Barré syndrome nowadays popular question only. Frequently they're asking, Guillain-Barré syndrome is basically ascending paralysis. Yeah? It is basically few disease we have ascending paralysis. So usually comes after two infections. One is your gully boy. GB is a gully boy. No, I always told, remember the gully boys. The gully boy, Ranveer Singh and the Alia Bhatt. Okay. So they were down, they were like normal rappers, then suddenly they go to the top. So it's ascending paralysis. One thing, but important is what they like doing, two things, camping. They do camping. Okay. They do camping, Campylobacter jejuni. Gully boys like to do camp. They like to do camp, number one. Number two, they like Zika noodles. They love Zika noodles are very popular here in North India. So one is Campylobacter virus is Campylobacter jejuni. Campylobacter jejuni is the bacteria. Zika virus is the virus which causes Guillain-Barré syndrome. So don't forget. Gully boy, Ranveer Ali, but favorite is to do camping and eat Zika noodles. That's it. Okay, very simple. I'm not going detail too much. LGV, lymphogranuloma venereum means itself, you know that is basically the genital we call it as genital elephantiasis. Genital elephantiasis. That is basically what? It is basically caused by chlamydia. See, chlamydia trachomatis. You know very well that is your L1, L2, L3 variant. Okay, genital testing. Okay, so this is a genital ulcer. It causes a genital ulcer, one of the painless ulcer, but lymph node will be painful. So characteristic is bubo. Remember, bubo is coming here and bubo and ethiomin, and the test is called freeze test. Okay, test is freeze test. So that's it. Okay, very, very simple. You will not forget it also. You'll remember. So if you forget, also remember, see, people use LG stove. No, people use LG stove. Who is using this girl, Eti? Eti is girl who is using LG stove, the same Eti in doctor. Okay, so she used LG stove to make what? Bun, bobo. And they make what? They like make fry, bun and fries, even gravy, grooves and habits made. Derma using fries. That's all. Okay, so bun for bobo, fry for freeze test. That's it. Who makes? Eti makes, and she get genital elephantiasis or ulcer. Okay, terminal spore. In terminal spore, we have to drumstick say what you say. I always say with the drumstick you can make tet sound. No, with the drumstick you always make tet sound. So clostridium tetani is the terminal spore, clostridium tetani T. But if it is a tennis racket appearance, you already have clue there. Again, terminal, but tennis racket like this means, so TR is there. So this is basically tertium. TERTIUM, tertium. Okay, clostridium tertium. Okay, easy. Okay, you can remember like that. Now Naegler's reaction. So these are the things. See, where you see the Nagless reaction, that's what I told Nagarjun. This is the Nagarjun story. Nagarjun means itself, you should remember, Mr. Perfect. He is Mr. Perfect. He does everything crazy. Okay, he does everything crazy. What he does, he has a, first of all, he always has a target. He has a good target. Good target means his shooting thing is very good. Double zone hemolysis, you call like this double zone hemolysis. Second, reverse. He does everything ulta. I told now, he normal camp, he do reverse camping. Okay, and he drinks litmus milk also. So these are the, but commonly asked is double zone and Naegler selection asked. So Naegler means it's of Naga. Naga is perfect. So Clostridium perfringens. Clostridium perfringens, frequently asked question, so you can't miss it. Okay, double zone hemolysis, target hemolysis. Target lesion is different. Target lesion is in Lyme's disease, you will see. Okay, target hemolysis is here, reverse cap. Okay, Clostridium perfringens, frequently asked question. Now, pseudomembrane colitis, antibiotic also diaremesis of, you know, that is, I can't give you clue. What happened whenever you take antibiotics? What happens when you take antibiotics? Your GIT becomes difficult. The GIT becomes difficult. Okay, difficult. So the idea is to say the bacteria which is causing is called Clostridium difficile. Clostridium difficile. Okay, Clostridium difficile. Also asked question. Treatment of choice. You know, usually the causative agent. The etiology is usually, you know, the most common one is Clinda and cephalosporin. But the treatment here we're using is metronidazole and your vancomycin. Vancomycin. Fidaxomicin is another one, new one. Uh, uh, Fidaxomicin. Okay, I'm not going to go bring it here again. You already have enough, so I don't want to bring it here. So, but remember, okay, fidaxomicin is another one, which is new drug for this one. Okay. That's it. Okay. Now, next is what? And Vanco, remember, only oral Vanco, not the IV Vancos. Okay. I'm not going too much detail. Again, you'll confuse. I want to stick to the revision part now. Okay. So now, where is the this one? Hmm. Now, electrical precipitation. Electrical precipitation, shick test. Both are for electric is like electric current. When your throat is like electric current in which disease? Which disease become like electric current? Diphtheria. So electrical is for diphtheria again. Diphtheria, correct, diphtheria. And Schick test is also, it's a susceptibility test. It's just a testing, it's a skin test, absolutely. It just checks the susceptibility of diphtheria. I mean, if you remember, shortcut is spin. If susceptible means it's positive. If it is positive, then it is susceptible. Okay, that's it. You just remember only susceptibility of diphtheria. Okay, Shika, diphtheria, elect gel. Elect is like electric current. Elect, electric current, diphtheria. Both for diphtheria. You know that one. Okay, yes. And it's a type 3 hypersensitivity. Type 3 sheet test is one test where type 3 hypersensitivity will come. That's all. And EPEC, you know, commonly asked questions in E. coli. P for pediatrics. So EPEC is basically for pediatric population, pediatrics. So pediatrics and EIC, invasive. In invasive, very important is that you should know this is very much like a shigellosis. Shigellosis. And here, this is mediated through which one? Vanillin mandelic acid, VMA acid, okay, receptor. Through this only, it acts through the vanillin mandelic acid, okay? So V is here. And other one is that invasive means, who is invasive? Serini is invasive, like Serini test positive. This girl, Serin, she is very invasive. Okay, Serin is very invasive. That's it. This is the point I will ask you. Important question. Okay. In pediatric population, a child, P pathogenic, and this thing. T, toxigenic, you know, toxigenic means travelers. Travelers diarrhea, which is similar to almost like a cholera. Okay, I'm writing T only. EH, enteroemergic is the most important one because this one especially, EH is similar to which this meter, which is Shiga-like toxin. This is the one, Shiga or Shiga-like or verocytotoxin. Okay, verotoxin, very dangerous one. So that's what happened in EH is enterohemorrhagic. Uh, it is O157H7. Okay, if you remember, same unit only. Okay, so this is the one. What it causes, if you remember, hemolytic uremic syndrome and hemorrhagic colitis. Hemorrhagic colitis, two important complication it causes. Okay, hemolytic uremic syndrome, not going to talk. Basically there you have the here anemia, rat, shortcut is rat, no. So there you will have here, renal failure and anemia and thrombocytopenia. Okay, that's what I'm not talking. So this is a dangerous one because it causes disease same like a shit, that is dysentery. You will have dysentery. Bloody diarrhea, so dysentery will be there. Entero-aggregative. Entero-aggregative means it's aggregate. What do you aggregate? Brick. Okay, so you call it as a stacked brick appearance, stacked brick. So it's like aggregated only, no? Aggregate the brick together. Aggregate means you're combining all the bricks together. Aggregate. That's it. Very simple. Okay, I'm not going too much here. So you know all these things, you'll get it. Now, this one, when there is a white gray vaginal discharge with a pH is more than 4.5, more than 4.5, you can see it. And then whiff test positive clue cells. So this is very characteristic for which one you are? Bacterial vaginosis. BV, bacterial vaginosis, that is caused by Gardnerella vaginalis and mobiluncus. Okay, that you know, that is Gardnerella vaginalis and mobiluncus. This will go high and lactobacillus comes down. Okay, that will not go here. So remember BV means, you know, BV always what? She always whiffs. BV is wife, no? Wife always, she whiffs husband's husband. She whiffs the husband's whole body and she has a clue that the husband is cheating. That's what she whiffs always. Okay. And of course, grayish whitish, you have to remember. Okay. Curdy, you know that. No need to say. That's basically C for C for your candidiasis, candida vaginal discharge. Candida vaginal discharge. Green frothy. Yes, when you talk about green frothy profuse, we say who likes green veggies? Trisha. Trisha likes green. Whenever green and strawberry, you know, green and strawberry comes, I told green strawberry. Green veggies, green and strawberry comes. Green veg and strawberry is favorite for Trishas. Trisha. When I say Trisha, it is Trichomonas vaginalis. Trichomonas vaginalis. Trichomonas vaginalis. Never not to forget. Important question. The most popular quick treatment and prognosis test for H. pylori. H. pylori means the main virulence is urease only. So you have to check the urease breath. So urease breath test is the best test. Urease breath test. Better than anything, even the invasive mean you have to take biopsy or not, so it is difficult. So better to urease breath test, it's much better. Okay, yes. Now, two things, satellitism, stalactite. I always say satellite, who owns the satellite? Phil, because Phil, he wins the, which one? He's an Olympic champion, no? Olympic swimmer, Michael Phillip. Okay, Michael Phillip, Olympic champion. We call him Philip, but Philip. Some people call him like this, Michael Phillip. So what, when I say Phil, you already got the clue. Who will have a satellite that much rich? Who can be that measured? Of course, it will be only your one and only your Haemophilus. Okay, Haemophilus influenzae, satellitism, influenzae. Okay, other one, stalactite growth. Stalactite growth is given by stalactite, you know, the growth, it hangs, no, from the floor, like in the Kashmir in the winters, the snow hangs down, no, like that. That's the stalactite growth. So this one you have to remember, who owns the ghee stall? Ghee stall. Okay, who owns it? This is our Vasen. Vasen, that is basically Yersinia. Vasen has Yersinia. Yersinia. Okay, Yersinia. So that's the one. So Yersinia pestis. Yersinia pestis is for stalactite growth. This is also another question. Okay. So hanging. What is hanging? Yersinia pestis, stalactite growth. Satellitism for Haemophilus. Phil is rich, so he has a satellite. Okay. Satellite. But stalactite, ghee stall. Who's having ghee stall? Yersinia pestis. That's basically Vasen, the strain name. Yersinia pestis. Okay. Do you remember? Yersinia pestis. Tram track, a school of fish. You know that tram track, a school of fish. Who walks on the tram track? We told that who? The ducks. The ducks will walk on the tram track. The ducks will walk on the tram track, or the ducks will go to the school. Okay, tram track and school. Who goes duck? So duck itself given a clue. Basically, it's a Haemophilus ducrei. Yes, Haemophilus Ducrey. Ducrey. And you know, this is a painful ulcer. One of the painful ulcer. Apart from herpes simplex virus, the second painful ulcer is this one, genital ulcer. Painful genital ulcer. Okay, the duck cry, you know, cry is there. So cry means painful, no? That's what we say this name. And you remember duck. So tram track, duck walks on the tram track and duck goes to the school. Okay, duck walks on the, this is like a tram track. Where it's going, they go into the school. Okay, that's what, that you remember like that only. It's be easy. Now, woody nose. Woody nose, you know, these are all caused by your Klebsiella species. So woody nose is caused by Klebsiella rhinoscleroma. Yes, rhinoscleroma. Rhinoscleroma. So rhinoscleroma is basically woody, no? Scleroma is hard. So it is like a wood only. So there only what you have Miculites and Russell cell. Okay, forgot also your Russells and Miculites cell. R for Russell, And mycelium is also a scleroma. Okay, so they are common. Woody nose. Okay, that nose will look like a woody, right? That is question. Atrophy dent is repeatedly asked. Okay, ENT questions is basically caused by Klebsiella oceanae. Okay, Klebsiella oceanae. That is atrophic. Now, merciful anosmia. You get to smell. Patient doesn't smell anything. Okay, those things. Okay, so frequently asked question. CBNAT is for your Mycobacterium TB. Mycobacterium TB. So it is basically otherwise called it as what we call it as a you got a gene expert. Gene expert. Only thing is that apart from diagnosing the TB, it detects only the rifampicin resistant. Only rifampicin is not other antibodies. Rest other things, line probe, they detected everything, but this only the rifampicin resistance. Okay, that's all. Now, Kansasi and Avi, these all are the non tuberculosis mycobacterium. Okay, we call special ones. Okay, so Kansasi and Mycobacterium avium intracellular, the two, that is Kanaga Kansa girl, and Avi. Avi is a dangerous one also. Avi. These two people, they have what? They mimic what? TB, Mycobacterium tuberculosis, Mycobacterium TB. That's all. Okay, question. Now, swimming pool granuloma. Swimming pool granuloma, you know that when talk about swimming pool, is a who likes, Mary likes. So it is usually Mycobacterium marinum. Marinum. Mary likes swimming pool. Mary loves swimming pool. Mary goes swimming pool. So Mycobacterium marinum. Okay, that's it. Swimming pool or fish tank, whatever you can say pool. Okay, tubercular and lepromatous leprosy. Yes, these two leprosy. One important thing is that Pauci. One is Pauci bacillary, can be a question. Other one is a multi-bacillary. Pauci and multi. Okay, this is multi-bacillary. Okay, I'm not going to try too much. Tuberculosis is a mild form, so it will be what your immunity is good here. Your immune is very high. Here, immunity is low. Immunity is low. That's what happened. Here, the lepromin test will be positive because immunity is good, so lepromin test is positive. Positive. Here it will be negative. Only the tuberculosis mild immunity is good. So few lesions. You have only few lesions. So skin lesion here, many lesions, many nodules and everything you will have. Okay, dangerous, many nodules, typical line and face, etc. Okay, that's also one question. Mainly just say lepromatous is positive here. Okay, that's all. Now, type 1 type lepra reaction. Lepra reaction, see, lepra, L-E-P-R-A, no, R-A. So you have to get 5, no? So this 1 plus dash equals to 5. Here also 2 plus dash is equal to 5. That is important. So very easy. You put how much? 4, it becomes 5. Here you put 3. So I mean to say this is type 4 hypersensitivity reaction, type lepra 1, and 2, this one, 2 is type 3 hypersensitivity reaction. That's all. Very, very simple and easy. Okay. No mistake in this. Globi and sugar bundle appearance. Okay. So two organisms are there. But now for us, Globi and Cigar, leprosy people, what happened? They are poor. They become poor and they're thrown out of the city. So they depend on what? They eat the gobi, the kacha gobi, uncooked gobi, and they smoke cigar. The broken cigars fell down. Okay. So remember, these are the things they do. So it's basically Mycobacterium leprae. But cigar is also for sporothrix. We'll talk about that also. Sporothrix in a while. It's going to come soon. Yeah. Now, primary atypical pneumonia, walking pneumonia. See, that's what again I'm saying. Who likes to walk? Who likes to? We already talked about the people's queen. She's a people queen, and she loves to eat fried egg, walk. People eat everything. Goes to a mycoplasma. Mycoplasma. Okay. Mycoplasma is frequent as walking pneumonia. Sometimes you also call it as pleuropneumonia-like organism also. Okay, PPLO, pleuropneumonia-like PPLO, basically pleuropneumonia-like organism. But it is atypical pneumonia. Okay, this also can be asked. So they are same. PPLO pneumonia organism. The name is because of that only. Yeah. Now another very interesting is cat matsat. Cat. Who has a cat? Diana. Diana has a cat. So Diana means always I say this is your mycoplasma, because she has a cholesterol around her body. So then her favorite animal is cat. Diana's cat. Cat means it's of Diana is her favorite. Okay, Matt. What does a Matt do? Matt helps the Matt. Matt is the Matt Damon, the popular actor. He came to help which people? Who's flood affected people. Flood means it's if help the leptospira people, small people who are flood, rodent, rice rain, rice field, rodent one. Okay. So Leptospira. So Leptospira is mat. Who came to help them? The Leptospira. Okay. That is cat is cold agglutination test. Mat is microscopic agglutination test. Okay. Sat is standard agglutination test. So who is having a satellite? Apart from one is your satellitism, your microfilarias. Another rich guy has a sat. Who is that sat? Definitely your Bruce Lee, your Brucella. So remember, Brucella. Sat. Okay. Very simple. Bruce Lee has satellite. Bruce Lee has satellite. Satellite. Very, very simple. Okay. You'll not forget it. Easy ways to remember. Okay. You not make any mistake. One question, definitely they'll ask you. Cat is cold agglutination. Mat is microscopic agglutination. Sat is standard agglutination. Okay. So you'll not forget it. Now, this is the what I came here. See, this is the point why I was stressing that Dine's method and Dine's phenomena. See, Dine's M for M. So mycoplasma. This is for mycoplasma. Phenomena, P for Proteus. That's it. And what is Dine's method? Basically, you add this methylene blue to colony. Dye to the colony, it will stain. That's it. Dine's method. In Proteus, Dine's phenomenon, basically what happened when two same species grow, then what happens? Swarming will merge. Swarming will merge. That's it. But if it's a different species, the swarming growth will not merge. That's it. Okay, merge or not merge only. You don't need to know the detail. Just remember, P phenomena produce mycoplasma stain. That's it. Okay, fine. For exam purpose, you don't need to remember. Okay, it's fine. Now, Neisseria meningitis and gonococcus difference. See, one thing is this meningococcus is, it causes meningitis. So definitely it has capsule. Okay, here we don't have. That is one difference. Second one, meningitis means itself. It is a lens shape. It is like a lens shape. But gonococcus G is there. No, so it is like a G. So like this. So it is bean shape, kidney bean. Kidney or bean shape appearance. Kidney or bean shape. Okay. The next one, biochemicals M and G. So here M for maltose plus glucose. They are fermenting this. Here only G. So only glucose. Glucose only. That's all. Simple. And the disease Neisseria. So this is the main difference. One difference you can always expect. And another examiner's favorite question is this one. MAC. See, MAC complex. No, that is this membrane attack complex. This is membrane attack complex. Membrane attack complex. Yes, deficiency leads to which infection? Our Neisseria. Membrane MAC means itself Neisseria. Frequently asked question. Neisseria, especially meningitis here, but any Neisseria infection. Okay, that's it. This is also important. Mac also likes Nesha. Nesha's boyfriend is Thyre Martin, New York, but Mac also likes compliments Nesha. Okay, remember like that. Okay. C1 estrase. When C1 estrase inhibitor deficiency is there, you always get what? Everything goes swelling. Everything goes swelling. So when if ester is not there, everything goes swollen. No ester means you will have a swollen. Okay, so mean hereditary angio neurotic edema. Everything goes swelling. Okay, everything goes swelling. That's it. Okay, angiotic edema. Now, Fitzhugh-Curtis syndrome or Fitzhugh-Curtis syndrome, that is basically perihepatitis, and ophthalmic neonatal. Basically, these are complication of which usually most commonly it is the gonococcus, Neisseria gonorrhea or gonococcus. Okay, followed by chlamydia. Both can cause. Okay, both can cause this complication. Okay, gonococcus and chlamydia. Okay, Fitzhugh-Curtis and ophthalmopneumatory means struvite and stagonism. Already we know struvite is big stones like like in the top of the deer. No, it comes like this. So this one. So that is basically for which one? When we say phosphate, you already have a clue. P for phosphate. So it is basically your Proteus. Exactly, alkaline urine. Proteus, because Proteus forms what? Alkaline urine. Alkaline urine. Okay, alkaline urine because of urease enzyme here also. Okay, so stagon, struvite, phosphate stones means Proteus. Okay, Wheel-Flix reaction, it is for detecting the rickettsia. Rickettsia. Using what? We are using the Proteus antigen. We are using the Proteus antigen. Using Proteus antigen. So that's what we called as also heterophile reaction. We also called as heterophile reaction. So in Wheel-Flix reaction, there can be this step. Only OX19 positive and OXK positive and there can be condition where OX 19, 2, both will be positive. So this way they'll ask you one question. For 19 positive means your type is epidemic and endemic typhus. Epidemic and endemic typhus fever, yeah? Epidemic and endemic typhus. Okay. Now, what about K? K is basically scrub. We can make it like this. K. Scrub. Okay. K. Scrub typhus. Okay. Scrub typhus. Remember, scrub typhus. Okay. Easy. 19 and 24, your rickettsia, 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 rickettsia. Okay. I'm going to RR. I'm going to write rickettsia, rickettsia. And one is rickettsia conori. Conori. That's all. Okay. Where one thing will be negative is nothing will be there. Everything negative means bichari. Akari is a bichari. Okay. Akari is a bichari. That means rickettsia akari. He is a bichari. Remember, akari is a bichari. Hindi bichari means no sad, nothing is there. Like that. Okay. So it's easy. Like that, you will not forget it. Okay. Yes. Remember that one. Now, next one. Malignant otitis externa. Now, malignant otitis externa, you know that the main cause is a Pseudomonas. Pseudomonas aeruginosa. The story and all I've noticed, I told you guys to remember Ekta Kapoor, because ecthyma gangrenosum, and she pierces her ear a lot. So, all the ear infections she get. Okay, swimmers ear, malignant otitis externa, Kushi syndrome, and, all colorful pus, all because of this one. So, Pseudomonas aeruginosa, in especially diabetic mellitus patient, DM patient, okay, common. Mellidosis. Talk about the mellidosis or Vietnam time bomb. Mellidosis, Vietnam time, a real mellidosis means itself. Nowadays, to get a real melody, you need only fake people. So it's caused by Burke, Hole, Daria, pseudo Malay, okay, pseudo Malay, okay. Remember, fake people make good melody. Pseudo means false people make good melodioses, okay, not the Malay, because the Malay one calls the glanders, but the pseudo Malay fake people are more dangerous, like Vietnam time bomb. They are like Vietnam time. Pseudo people are like a Vietnam time bomb. What about Neal-Moses reaction? Neal-Moses reaction is basically, it's a guinea pig. In guinea pig, you're looking for the scrotal swelling, scrotal inflammation, basically looking for scrotal inflammation. Okay. So here, everything will be there, but the organisms are CAT. Cat is positive. Okay. Cat for, because you know that C stands for your, this one, your Rickettsia conori. Other one is your Rickettsia acari. Also Rickettsia typhi. But which is not the your Rickettsia Pravasaki is not there. It will not be positive. That's it. The main one which caused the epidemic typhus, it will not be there. That one point. Okay, please remember. Next is your typhoid fever. So typhus salmonella, our salmonella typhi, Salman fever. Salman's doctor name is Dr. Basu. Basu, Basu, you know that. So first week, this is B for blood culture. A for antibody detection. Antibody means we're talking about Vidal test. Yeah, Vidal test. S for stool and urine culture. Okay, culture sensitivity. So you know that till first week, it's the blood culture. This is repeatedly asked question. And still second week. Till second week is your antibody. That is your Vidal test. Okay. Now stool, these are for third and fourth week. End of third and fourth week. Okay. So this is the thing. Okay. Till end of first week blood, till second week Vidal test. So this question can be asked. So that's what I think. Okay. Again, same way. One more. This thing is dengue fever. They'll ask you based on the weeks. So till fifth day, from the day of fever till fifth day, then till after 1 week, then till fifth day is this, and after 1 week, after 1 week. So till fifth day, the best is which one antigen? NS1 antigen. Okay, for clear. Some books say still 1 week also, but NS1 antigen given. Most book it's mentioned NS1 antigen only. Stick to it. After 1 week, yes, you can go to IgM. IgM dengue you can check. Okay, IgM dengue antibody you can check. That's all. Okay, and later on IgG also will go. Okay, now for this is important. Now, yeah, syphilis diagnosis, you know that is, see, first of all, there are only two things: screening and specific test. Screening and specific test is very, very important. Screening test, you know that is basically VDRL, basically the VDRL1 and the I'm sorry. RPR. Okay, these two. So this is one good thing is neurosyphilis also. You can use for VDRL, you can use for neurosyphilis also. Screening and prognosis to check the titer. Both are very, very important. Okay, but specific test. Specific test, you know, anything start with the name itself. Example like this. TPI, treponema pallidum immobilization test, and then TPHA, treponema pallidum hemagglutination. Also, we have TPPA, okay, particulate agglutination, and also FTA ABS. FT-ABS antigen. So everywhere you see there is treponema, TP. So this is a specific test. Okay, this is non-specific test. That's a screening test. That's all. This is only in syphilis very important. This only. Okay. Now, what are the tests for staph? This we talked many times. We have spoken about this. When Staphylococcus aureus comes mischief, I told remember the staffs. Remember the Mallu staffs, Mallu nursing staffs, no Mallu nursing staff. So they all have cat in their house. Okay, cat. So cat less positive. And then what else? They apart from this, they work in depth. They work in depth. So many enzymes. DNA is important is DNA, and enterotoxins, it's okay, not that this thing. And P is important, phosphatase, and T for thermonucleus. These are very, very important enzymes. And of course, Mallus, they like money, huh? Mannitol, salt agar. So these are the very important specific tests only for your Staph aureus. Okay. And of course, we forgot the coagulase also. They buy a lot of coal because they have a lot of money. Gold. So they buy coal also. Coal coagulase. Okay. Cat coagulase, DNA enterotoxin thermonuclease. Very important. Pyogens, Streptococcus pyogens, bacitracin. First of all, bacitracin and PYR. PYR, you already have a clue. PYR. Basi is the girl who has pus. Basi has pus. Okay. Basi has pyo means pus. No. Basi got pus. So these two. Okay. Agalactia always we say, and this is group A. Okay. This is a group A. Here, Streptococcus agalactia I always say, remember, boys, the boy from Agartala. Okay. Boy from Agartala. He likes to do what? Camping with hippopotamus. He's a very strange fellow. Okay. So why did I boy? Because this is a group B Agalactiae. Group B Agalactiae. And what is important here? The two tests are important here. What are the two tests? Cyclic. That is, this is not cyclic AMP. It's a camp test. Okay. Reverse camp is done by your Clostridium perfringens. I'm going to write it here. Reverse camp is done by Mr. Perfect Nagarjuna. I told a little bit he's a crazy fellow. Clostridium perfringens. Okay, Clostridium perfringens. Agalactiae campus. And also hippurate hydrolysis. Hippurate hydrolysis, but the hippo, because I say hippo, because hippurate hydrolysis. Agartala boy likes to do camping with hippo. That's it. He's a bit crazy. Streptococcus pneumoniae comes automatically. I told you we study Streptococcus pneumoniae where in our school. Which group? Bio group. Okay. So B for bile solubility. The positive. I for inulin fermentation positive. O for optochin sensitivity positive. Okay, T test. That's all. And of course, you should know carom coin. Carom coin appearance. Okay, or droughtsman. Sometimes they call us droughtman colony. I'm talking about the colonies here. Okay, the colony is basically carom coin or droughtman's appearance. And the bacteria itself, it looks like this. Okay, lanceolate shape. Okay, diplococci lanceolate. That's all. This much only. Okay, step number 1. Toxic shock syndrome, you know the toxic shock syndrome, it is caused by, we always say, female fatal, FFF. Okay, so enterotoxin, F, dangerous one. Female fatal, we say female fatal. Okay, fatal. So F toxin. SS is usually caused by skin. No, it is a skin related. So it is epidermolytic. Epidermolytic or exfoliating the skin. Exfoliative toxin. That's it. Very, very simple. Okay. Yes. Now next. Yes, a single stranded DNA virus and the double stranded. Yeah, so you know most of the single, there are exception. Few only one single stranded DNA. So single is our single paru. So parvovirus. Okay, you know that single paru. Isphaerai in Devdas, paru is single. Okay, single and she's small. Choti paru. Okay, and the double stranded DNA is DNAs, RNAs are usually single stranded. Now, double stranded RNA, you have rota. Rotavirus means that comes under Rio viridae, no? So Rio rota. Rio virus, rotavirus. Okay, please remember. Very, very simple. Easy. Temporal lobe encephalitis sporadic. This is a complication of which virus? Okay, usually you know about herpes virus, but this exact word sporadic comes, no, or temporal lobe comes, you talk about HSV, herpes simplex virus 1. Okay, so S is there. Because overall most common cause of encephalitis is generally it is your Japanese encephalitis overall, but sporadic and temporal lobe comes, it's a complication of HSV1. Okay, that's what this question I wrote. And there's one more, Molarix is caused, Molarix meningitis by HSV2. That I'm not talking. If you talk 2, then become too much. I'm just stressing only the most important points. SSPA, PL, repeatedly asked. Subsclerosing panencephalitis will be your, which one? Your measles. Whereas PMLE, progressive multifocal leukoencephalitis, people who go crazy when they go to a JC Penney's. JC Penney's store in US, it's a clothing store. People go crazy there, PME. So I mean to say JC virus. JC virus. In measles, complication is subsclerosing panencephalitis. You already have here. Yes, yes. You see, yes and yes is a measles. Yes, yes. Okay. Subsclerosing panencephalitis. Here it is JC virus. Okay. Paul Bunnell monospot. Paul, what? Paul went to Paul, where Paul, he gave his first kiss. He had first alcohol at the age of 21 in bar. You remember, yeah? In bar, he had his first kiss. Kissing disease, that is infective mononucleosis. So 21 is a receptor name, but I mean it's bar because Epstein-Barr virus, EBV. B is for bar, Epstein-Barr virus. So I'm writing it bar, okay? Epstein-Barr virus, symbol like that, okay? And the receptor is, of course, I'm writing CD21A receptor is the receptor, okay? That's it. This is what I'm not writing everything. So this is a monospot Paul Bunnell test, is basically heterophile test. We're using sheep RBCs or use heterophile antibody test, antigen antibody test, okay? Now, next is Roseola infantum, exam subitum. So it's very easy. Roseola S is there, subitum S is there. So 2 S is there. No, so let's make it as HHV 6 and 7. Right? 6 and 7. So HHV 6 and 7, also one repeated question they can ask you. So if that is asked, then they will know, examiner know you will get confused. So they might ask you erythema infectiosum also. Here there is yes, but not that characteristic. Here in pros have. So it is 5. And slap cheeks. With 5 fingers you slap. No, 5 fingers you slap. So it is basically erythema infectiosum is basically it's called 5th day disease. It's not HHV5. 5th day disease. Fifth HHV5 is CMV, cytomegalovirus. Don't bring it here. We call 5th day disease, which is caused by our parvovirus. 1, 2, 3, 4, 5. Parvovirus. Okay. However you want to remember, it's very, very simple. This is the only single standard. Single, Paru is single. She's single because she's choti. She's single. No one likes her. Okay. Yes. Remember like that. So now see this combination of diseases. When you have a combination of diseases like, swimming pool conjunctivitis, pharyngoconjunctival fever, hemorrhagic cystitis, this is basically children with all this combo comes. So the only thing you're going to do is adenovirus. And I told you adenovirus, Adnan Swami has a space vehicle. He also having a space vehicle. Like our Bruce Lee, Brucella has SAT. This guy also has, and satellitism by hemophil. Michael Phil has adenovirus. Adenovirus also space vehicle. He also has a space vehicle. He's very rich. He has his, Adnan Swami has his own space vehicle also. Okay, space vehicle. Okay, to help the children. So this is all another thing. Okay, keratoconjunctivitis, infantile diarrhea, or combination of symptoms means it is yours. Adenovirus. Antigen shift and elution, Shift means itself, I told shift car. Always remember the shift car. Shift car every 10 years once it goes, which one? Genetic modification. Genetic modification, and it is worldwide. Nowadays, our shift, Maruti shift is worldwide. Okay, worldwide. Shift, Maruti shift. I'm writing Maruti shift, not to confess. So very simple. This is gone by which virus? Your influenza. Influenza, and Maruti shift is a class. It's an A class car. People love it, right? Influenza A virus. Influenza A virus. So everything is important here. Every 10 years, it goes what? Genetic reassortment. Assortment. Okay. So that's what it is causing most pandemic. So shift is very, very important. So this is antigenic shift. Okay, for influenza A, that is important. Elution also caused by elution is basically hemagglutinin, reversal of the hemagglutinin sialidase the thing. You know that one. So, hemagglutinin helps in entry, elution, the sialic as the neuraminidase helps in the virus to come outside. So opposite function of hemagglutination. So that's called elution. So the term elution is for influenza. That's it. That's all I wanted to put. Okay. So like that, there is something called ADE. What is ADE? ADE is basically antibody dependent enhancement. Antibody dependent enhancement by non-neutralizing antibodies. This is basically what happens when one virus attacks. Usually the virus has to, our body provides immunity that protects from the next virus. Here what happened when the first virus attack, the immunity, the antibodies, instead of protecting from the second, it increases the infection. So that is basically happening in your dengue hemorrhagic fever. This is important question. Dengue hemorrhagic fever. It's common. Okay. Forget also, it's already here. DE dengue. Okay. Dengue hemorrhagic fever. Antibody dependent enhancement. Okay. Very simple. So that's all. Now laryngeal papilloma, human condyloma, you know very, very well. This will now it will go very, very fast. This is caused by your human papilloma virus. Which one? 6 and 11 characteristically. Okay. Laryngeal papilloma, condyloma means this one. Yes. And cancerous, 16 and 18 causes the cancer. So I don't want to tell that one. You already know that. Okay. HPV. 16, 18 for cervix cancer. Not only cervix, anal, pineal cancer many, but cervix common. Okay. Condyloma acuminata comes here. Now molluscum contagiosum. Molluscum, condyloma acuminata is basically genital warts. Okay. Genital warts. Okay. Now, next. Molluscum contagiosum means a cheesy material coming out. I always say to remember pox. Pox virus. Okay. Molluscum, the cheesy material, umbilicated cheesy material, no? That is the molluscum umbilicated lesion, umbilicated lesion with cheesy material. Okay, pox virus that you know very well. Henderson-Peterson body. Okay, so that is important. Quasi-species. Yeah, one hepatitis virus that is same somewhat. It has at a time there are many types of viruses. Okay, that is very quasi C. So it is hepatitis C virus. Okay, hepatitis C virus. So that's why there's no vaccine. Quasi-species many subspecies same time. So you don't have many subspecies at same time you have. Okay, so I'm sorry, excuse me. I'm just sorry. Okay, so now I'm sorry. I'm going to do that. Yeah. Sorry for the interruption. Okay, so now what happened? Many subspecies at same time. At same time. Okay, you have that's what there is no vaccine. No vaccine. Remember, there is no vaccine for this. HCV doesn't have any vaccine. It's very difficult. Like our HIV, somewhat, but HIV different mutation thing. Here many subspecies thing. Okay. Now next is your reverse transcriptase. Reverse transcriptase and two single stranded RNA is there for which one characteristic? It is for your HIV. HIV. You know that one. Okay. Two single stranded RNA segment and reverse transcriptase message is for HIV virus. Okay. Please don't forget. This is all something very important, easily to remember. A rabies bodies, rabies body we call it as Negri body. Yeah, Negri body. And then what is a stain? Always I say when you have a rabies dog, please sell it. Sell it. Okay. Sell it. So basically, cellar stain. It's called cellar stain. Okay, very important stain for this. Okay, and you know the shape of the rabies. It's a bullet shape. That is also important. Bullet. Now, rabies best test. You know that rabies best test is direct fluorescent antibody test. You detect the antigen, but you're using this. Okay, DFAT. Okay. That person repeatedly as rabies means best is that's what usually you do ELISA, PCR like that, but rabies it's different. You do direct fluorescent test from where? Posterior nape of the neck, from the hair follicle in the nape of the neck. Okay, from there, this is also important. You take the smear from there and then do the this one direct fluorescent antibody test. Okay. Coplic, this and all you know very well. Coplic means itself automatically in your mind it should come. That is your measles. What about a Forshimer? Forshimer is also this coplic in your oral cavity opposite to lower molar. Forshimer is here R. There are two R. So it is rubella. Rubella is also called German measles. Yeah, don't forget German measles. Measles is otherwise called rubeola. Rubeola. Okay, a lot of twitches here. So just remember. Okay, that's it. Next, fruit bat. That disease recently asked question every time. Fruit bat for Nipah virus. Nipah is the best virus. Nipah viruses has important role. Then, of course, Ebola also has, but more for Nipah virus only. Okay, Nipah virus. That's it. And vaccine-associated paralytic vaccination paralysis caused by which polio? We have polio 1, 2, 3. So now this is caused by the polio type 3. Type 3 variant. Type 3 variant has causing the vaccine-associated polio paralytic. Okay. Coxsackie A and B, both cause the which one? Hand, foot, mouth disease. Hand, foot, mouth disease. Especially A is more important. Okay, hand, foot, mouth disease. And another thing is that this is causing herp angina. Important question, herp angina, and also hemorrhagic conjunctivitis. Hemorrhagic conjunctivitis. Okay, conjunctivitis. This is for Coxsackie A. Coxsackie B is important. They're asking because, and of course, it causes the flaccid paralysis. Flaccid paralysis. Yeah, important. This also they can ask for flaccid paralysis because in alphabetical order, after A, then A and B. So first comes the F and then comes the S. So here there will be spastic paralysis. Because of the spastic paralysis, there is something called, the disease name also start with B only, Bornholm. Bornholm's disease. This is expected. Okay, they can ask you question like Bornholm disease. So Bornholm disease means itself, that is basically the pleurodynia, devil's grip. So because the chest muscles go very tight, it looks like a heart, but it's not heart. It's because the muscles spasm. So we call it as devil's grin, pleurodynia, called also pleurodynia. Pleural pain, but that is basically the muscle paralysis, like a Bornholm. That's it. Okay, this one. Now, different strains, already. We are super quick. MMR, for measles, it is your Edmonston, Zagreb. Okay, example, Garib, no, you remember Garib people. Garib people gets measles vaccine. Okay, for mumps, I always mumps and rubella. So for mumps, I always say anybody with big, bumpy, that his name is called Jerry. Geraldine. Okay, Geraldine. Jerry mumps. Rubella already have a clue. RA 27 bar 3. Okay, easy. Now for yellow fever, that is basically 17D. Okay, yellow fever will be, yeah, 17D. Chicken pox, always after eating chicken say okay like this. Yeah, okay strain. And for Japanese encephalitis, that is your ESA 14 2 14 2. Diphtheria, Park William is helping the diphtheria people. Park William H strain. And for BCG, that is your Danish strain. 1331. Okay, these are the frequently asked, the things you cannot make mistake. These are the strains. Okay, so 100 we have finished. Now only 50 left. Very easy. Already everything. Everything's given there. Only you have to tell me the answer. Keep on saying the answer. So you have this fried egg colony, and spaghetti and meatball appearance, and grape banana. So when you have all this variety of foods, which is that fungi? That fungi is basically mala. Our mala likes to eat, yeah, mala. When I say mala, Malassezia furfur. Basically, Pityriasis versicolor. Okay, Malassezia furfur. Malassezia furfur. That is basically Pityriasis versicolor disease. Okay, it's an important question, but also don't forget Mycoplasma. Also, you have fried egg colony. Fried egg colony. Okay, that's also important. Fried egg. Diana also like fried egg. But here, this one, our mala also like fried. But one thing here, you have to put olive oil. Mala likes it with olive oil. You put olive oil only, the colony will grow very well. Okay, you'll get very proper colonies. Okay. Now, trichophyton means, trichophyton means it's dry, so it affects your skin, hair, nail, and you know that try with pencil. So pencil shape, you have a pencil shape, pencil tip or pencil shape, macroconidia. This, repeated last question. So always try with pencil. Okay, I'm going it fast, so you know it. We don't have time, so you revision. So that's what. Now this one revision is very important. Epidermophyton, again skin plus you have N here, so it is nail. And I always say Ebi is a guy, club owner. He's a club owner, right? Club owner. So here the macroconulia is club shaped macroconulia. Okay, club shaped. Okay, important. Now, repeatedly asked question. Microsporum, again, skin with always nowadays hair is micro hair. No, hair is micro hair. So that's also important. So here what I say, here already have a clue. So just spindle shaped. It is usually spindle shaped. So you have a spindle shaped macroconidia. Okay, spindle shaped. It's like this. It will be like this. Spindle. Club will be, like this. Like this, club shaped. And pencil, pencil tip. It will be like a pencil tip. Pencil appearance. Okay, very, very simple. You will see the original picture. I have videos for that if you have time. If not, no problem. Yeah, you can go through the picture quick revision. Okay, yes. Now, look at this one. Now, here comes your sugar bundle. Who likes sugar? Who likes the star? Who likes a splendor bike? And who works with the flower? So, this all goes to only one guy. Who is that guy? Our gardener, rose gardener, that is Sporothrix. Sporothrix shankai. Yeah, this is also called rose gardener's disease. Rose gardener. That's what rose gardener. What he do? He likes to smoke his cigar. He likes his splendor bike. He looks the stars at the night, and potassium iodide also for treatment pot and flower like conidias. Very, very important. And this is the only one where it is a subcutaneous fungi and also what? And just dimorphic. Both the features are there only for this one. Okay, subcutaneous and dimorphic. So please remember. Can have question. Sclerotic body, medullary body, copper penny, murriform cells. Okay, you know this one, what I mean. Whenever you see anything metal, it sounds like a metal. So it is chromoblastomyces. Chromoblastomyces. Shortcut you call as MMS also. People call it as MMS, copper MMS. So copper is chrome only, na? It's easy. MMS is same. Murriform, medullary body, murriform cell, S for sclerotic body. Okay. Don't confuse the asteroid body because only sporothic rose gardener, he watches the star at night, asteroid body. Okay. Like we have in medicine, sarcoidosis also, right? Yeah. So mold form, look at this one. You have a tuberculate form and you have a narrow budding isthmus. Narrow budding isthmus means you need to be very small. It will be very, very small like this intracellular inside the cell. Okay, very small, very, very small like this. Okay, narrow body. So and who? TB like. So tuberculate means you have to remember histoplasmosis. Histoplasmosis capsulatum. Okay, very Ohio disease or caveman disease we call. So, but main thing is please remember it looks like a tuberculate, like a TB, na? TB. Anything with like TB, it is your histoplasma. Okay. Okay, East. You know the figure of 8 means is of the 8 broad base, no broad base B. So everything is B, so it looks like a B. So blastomyces. Blastomyces. Okay, barrel shaped. We always talk about this barrel shaped spherules. We say there's a barrel. If there's a barrel, and if there is on the barrel something sits, what sits? Cock. The cock sits and goes to a valley. It goes through the desert and valley. Desert rheumatism, valley fever. So basically, it is coccidiosis. Coccidiomyces or coccidiosis. Okay, coccidiomyces imitis. Okay, that's it. Coccidiosis. This cock is, that's what, arthrospore. This cock name is arthrocock. We call this cock as arthrocock. Okay, so coccidiosis. Desert valley fever, desert rheumatism. Very simple. Okay, coccidiosis. Yeast form, pilot meron. So this is again very, very important. I told cartwheel, Mickey Mouse, all. So it will be like this Mickey Mouse, or it will be like a cartwheel like this means you know only one thing. That is your parasailer. Who goes usually on this? Parasailers. Parasailer, they drive on the parasailers having this marine wheel, they go to Latin America, whatever. That is our story. But now you have to remember this is cocky Diodis. I have a lot of clues within other videos. Now we are going revision, so I can't tell all those things. It will become too much time and you will not have time. Okay. So I'm going in this way, easy ways. Red, the reverse in SDA media, you have a greenish gray with red color and a broomstick or paintbrush. We always remember when these things, paintbrush, even a bamboo rat. Bamboo rat also will be here. Clue, a bamboo rat and all. We always think only one thing. This is a favorite of our which South Indian actor? Everybody's favorite, our Talai. Talai, no? Talaiva. So Talaiva is Thalaromyces. Thalaromyces. Thalaromyces is Marnifi. Thalaromyces is basically Penicillium. Penicillium. Marnifi. Penicillium marnifi. That's all. Okay. So this is important. Now, germ tube, germ tube is basically Reynolds Brody phenomena, very characteristic for Candida. But which Candida? Candida albicans, Candida albicans species, for albicans species only. Okay, that is important. Germ tube means that only. So basically, you put it in a serum, you will get a tube like this. Okay, that is a germ tube. Now, Cryptococcus neoformans, the best test is, always we can do India ink, and this is the only capsulated. Cryptococcus is the only capsulated fungi, only capsulated. There are a few more not important for us for exam, but this is only capsulated fungi. So you can do India ink, you can go bird seed agar, urease test, melanin, so many things are there. But the important is what? Latex agglutination. Latex agglutination is the best test for, and Beck rapid test also. Rapid agglutination test, remember, it's frequently asked. Rapid also, rapid and best. Easy. Okay. Hyphae in aspergillus. Hyphae in aspergillus, it will be very much, it will be the clues that A for acute angle. Pictures all I have added in this thing in my images. You can see. I have just now only remember. Okay. Acute angle. S for septate. Septate hyphae. Okay. Septate hyphae. It will be like this. Like this acute angle septate hyphae. So like this properly septate. Okay. Mucormycosis like this. Shapeless, So I mean to say they are wide angle. M is like W, no? M and W similar. So wide angled aseptate. Aseptate means no septate. Hyphae. That's it. Okay. Very, very simple. Now next. This one. Cryptocyclospora, again, very, very important, frequently asked question. Here, mainly the size has very, very important role. So it is usually 4 to 6 micrometer. Then it becomes a doublet. Cyclospora, first from crypto, you start. Crypto means small, no? So start from the small one, crypto. Okay. Cyclos 8 to 12. And then here 24 to 36 micrometer. And all are acid first. All are acid first. That's what we told before also. Here, only important thing you remember, the autofluorescence. Autofluorescence is present only in these two. Spora will shine. Spora will shine, but crypto will not shine. Okay, cryptosporidium will not shine. That's one important thing. And here, this be circle shape. This is a circle, but here isospora will be, that oval shape. No, oval with two ovocysts inside, oval shape. Okay, that's it. Now, important treatment. Now, what you do? All causes the diarrhea in the HIV patient. Most common cause of diarrhea in HIV patient, that all the three can cause HIV. Most common cause of diarrhea. And cryptococcus, most common cause of meningitis in HIV. Here, it's most common cause of diarrhea. Okay, in HIV immunocompromised patient. Treatment is nitazoxanide. Okay, Nita Ambani has a cryptocurrency. That's what we remember. Okay, Nita is the owner of cryptocurrency. Crypto. Okay, and these two you will have cotrimoxazole. Nothing much. Cotrimoxazole. That's it. Okay, very simple. Now, next. Primary meningoencephalitis is caused by which parasite? PAM. I said Pamela Anderson. Pammy. Pammy means is if I told Pamela Anderson. Pamela Anderson. This is for actress, popular actress. So Pamela's boyfriend is what? Boyfriend is who dies in the swimming pool is Nigel. Nagel. Okay. So it is Naegleria fowleria. Naegleria. The terms are very, very important. Fowleria. Because you shouldn't confuse these two. Gay, who is gay? Our acorn. Acorn is a gay. Okay, let's make it as gay. So acorn is a gay. So granulomatous amoebic encephalitis come from acanth amoeba. Both are free living. These both are free living. Okay, Naegleria, this two, but see the terms are very, very important. You can expect one question this time because primary amoebic meningitis outbreaks happened recently. So you will have it. Okay, from swimming pool. Acanth amoeba, acanth amoeba. Okay, acanth amoeba. That is very important. Okay, strawberry vagina, we already spoke many times. Trisha loves strawberry. Trichomonas vaginalis, trichomonas, but everything is single here. You know that single trophocyte, only trophocyte is there, and single nucleus is there. Treatment is metronidazole. Both the partners should be treated. Okay, so it's a greenish discharge. We told greenish discharge, and then strawberry like vagina. Kala-Azar vector, Kala-Azar means itself, it is a sandfly. Sandfly. Expect this question also. That is visceral leishmaniasis. We're talking. Say Kalazar division means sandfly, or we call it as phlebotomous. Phlebotomous, okay. Phlebotomous, okay, phlebotomous. Okay, why I'm making mistake here? 1 second. Spelling. Phlebotomous. Okay, phlebotomous. Okay, that's all. Okay, yeah, some small spelling is there. It's okay. Phlebotomous, you remember. That's enough. Okay, mucocutaneous. When you talk about the mucocutaneous, you know this is caused by Leishmania. Leishmania, which one? The first one is Leishmania donovani. Kala-Azar Leishmania donovani. Mucocutaneous MC is by Braziliensis. Braziliensis. Leishmania brasiliensis. Okay, that's one. Duffy antigen helps in assisting the which plasmodium? Plasmodium by Vivek's girlfriend. One of the Vivek's girlfriend is Duffy. Vivek's girlfriend is Duffy. Vivek and Duffy has connection. Okay, Vivek and Duffy. Also, Vivek has Shafna. Shafna's dad. Shafna also girlfriend. Duffy also is girlfriend. He likes so much. Banana crescent. Anything with banana crescent means itself, which is dangerous one. Which one? Plasmodium falciparum. Falciparum. You will see the pictures later in my other image pictures. You want PDF also is there in that file. Okay, yeah. Sabine Fieldman. You know, Sabina is Sabina is pregnant. Pregnant Sabina. Pregnant Sabina. So pregnant Sabina usually get what from the cat? They get the toxoplasmosis. Toxoplasmosis for especially for Sabine IgG to detect the G. Okay, she's a good girl. Sabina is a pregnant. Sabina is a good girl. Okay, unfortunately, she got toxoplasmosis. So to detect IgG, we are using Sabin filament dye. So both M and G is important for diagnosis, IgM and IgG, but the IgG detection is by Sabin filament. That's the main thing. Okay, swimmer's itch, you know that. When you talk swimmer's itch, who gets in the swimming pool? Someone get. Who gets that itch? Our cystosoma. Sisters get cystosoma. S for S. Okay, S for swimmer's itch. You can remember like that also. Vitamin B12 deficiency is caused by your Diphyllobothrium latum. Diphyllobothrium latum. And one more thing, the cystosoma is the only one where it ends to skin penetration. Skin, which one enters? Cercaria. Cercaria. Everything is C, not metacercaria. Metacercaria is fico for the other trematodes. But here, penetration, skin penetration, especially by cercaria, cystosoma. Okay, that's very important. Yeah. Okay, that's all. Diphyllobothrium latum causes vitamin B12 and vitamin B12. But what about the other hemolytic? We have iron deficiencies caused by hookworm infections. Okay, important. That in paracetamol, they might ask which cause which one. Okay, Cassoni test means, you know, it's a type 1 hypersensitivity reaction. And which one it is? A type 1 hypersensitivity reaction, it is basically your hydatid cyst, echinococcus. Hydatid cyst means it's your echinococcus. We do this test for this one. Okay, allergic test. Macrophage in liver is called, you put the liver and eat in which one? Kupfer. Cup. So Kupfer. Kupfer cell. Okay, Kupfer cell. Kidney, messy. Messy has a kidney problem. Mesangial. Don't mess with the kidney. Okay, mesangial cell. Kupfer cell. Bones, you know, you bones, when you have any problem, you put a clast. So osteoclast. Not osteocyte or blast, it's a clast. When your bone is broken, you put a clast. Okay. So these are a few things. Okay. Very, very directly they might ask and you know, you would miss it. So I'm putting it here. So which is the maximum concentration? This one is the immunoglobulin, which is maximum concentration, half-life also maximum, placenta crossing, opsonization, chronic, everything maximum means it's by God. So IgG. Only God has longer half-life, no, not the man. So this IgG. Okay. Now, classic complement alternate pathway is the classic complement pathway. Only two people can have. One is God and milliners. They can have a classic life, right? Not others. Milliners. So it is IgG and IgM. Both are right. Okay. For alternate pathway, you already have a clue that is your IgA. So you can have a question mediated by IgA. That's all. Okay. Very simple. For any helminthic infection, allergic infection, you know, it is basically you have EE everywhere, allergy. Yeah, but here A also is there, not conflict. Any allergy helminthic means itself, it is your IgE. Okay, IgE means you always have eosinophil also rise. One second. You have eosinophil rise. EE. Everything is EE. Okay, that's it. Allergy. Any allergy, you will go with this one. Okay. Neutralization reaction. Neutralization already have a clue. N for A, N for Nagler's. Nagler's reaction. Other one is your Schick. Shika. Schick test. SH is Schick test. Okay. So Shika and Nagler are very good in neutralizing the problem. Nagler for Mr. Perfect Nagarjuna Clostridium perfringens. Shika for diphtheria. Okay. DiGeorge syndrome. You know, I'm not going to say that. This is basically the catch. How much catch 22? Chromosome 22. You know that one? Okay. Now here, catch, you already know that. I'm not going to say all the thing. Main thing, Here, the cardiac defect, abnormal face, cleft palate, abnormal face. T for this is what I want to stress here. T for thymus aplasia, and C for again cardiac defect, that is tetralogy of Fallot. H for hypo PTH, parathyroidism, or so that's what, because of decreased calcium will be there. I want to say parathyroid and thymus gland is a problem. There is no thyroid problem. No thyroid. That can be the question. No thyroid problem. Okay, that you remember. No thyroid problem. No thyroid problem. So these two means, so your third and fourth pharyngeal pouch has problem. Third and fourth uh, pharyngeal. I'm sorry. Third and fourth pharyngeal pouch problem. Okay, this you must have studied in many diseases. I'm just only stressing it. Okay, please don't forget catch 22. The problem is the chromosome 22, small. Okay, small. Okay, now HLA1 and 2, which are the cells? HLA1 and 1 is present in all nucleated cells. 2 is present only in the antigen presenting cells. Antigen presenting cells. That is basically shortcut. It always say bad microbe. Remember, bad microbes. Okay, bad microbe. So what is a bad microbe here? It means B for the B cell, D the dendritic cell, antigen presenting cells, dendritic cell, and M for macrophage. Can be a question also. Okay, that's it. All nucleated cell except RBC, because there are already no nucleus, exception, and your sperm. That's it. These two places we don't have, rest all the places we have. Okay, that's it. And they present the HLA, it usually present it to CD8. 2 present to CD4. If you forget also, here 1 is to 8 is equal to 8. Here 2 into, how much should be 8? 2 into 4 is equal to 8. That's all. Okay. That's what is stress. That's it. Interleukin 1, remember, it's for chemotaxis. Chemotaxis. You remember ought is like 8, no? 8. Okay. So interleukin 160 NF is very important for fever. Fever, they bottle, and of course, sepsis, gypsis, and all, everything it has and role. Okay, that's one thing. C3B, yes, frequent asked question. BP, always remember B is P. Okay, so BP. So that is B for BP. So it is opsonization. Opsonization. Okay. 5A, again, you have chemo. 5 letters. 5, no, 5. So chemotaxis. One is your interleukin 8, other one is 5A. Okay, both are important. Chemotaxis. Hypersensitivity reaction 1 to 3, 4. I'm not going to talk much here. You already know very well. In hypersensitivity reaction 1, all the allergic reactions will come. All allergy, all allergy, your Cassoni allergy and Cassoni test, anaphylactic reaction, and the Prusnich-Kushner reaction also will come here. Theobald-Smith will come here. Okay, that you know. And for hypersensitivity 2, the shortcut everyone knows is that my blood group is RH. My blood group is RH positive. Okay, so you know this one. Here also I'm not going to stress too much, because here I'm going to short with myasthenia gravis, blood for any blood transfusion, erythroblastosis fetalis, RH incompatibility, the same only, incompatibility. Okay, those things. And for G, there are many things, because you have G for good pasture, Graves' disease, no, another important is graft rejection, hypergraft rejection, hyperacute. Okay, hyperacute graft rejection will come in this disease, that you should know. And here R for rheumatic fever will come here, and H for hemolytic anemia, hemolytic anemia. P for pernicious anemia. Okay, so it's a short view only. Okay, you should be thorough with this. I don't go everything. So my idea is my blood group is RH positive. It's a shortcut that you remember, and everything will be fitted there. Okay, right. Okay, next for HSV hypersensitivity 3 also very important. I always told 3 for trident. No, trident is like this. So trident is Lord Shiva's weapon. No, so that is how it looks, sharp. So shortcut is sharp, SHARP, sharp metal. Remember, sharp metal. So S for, I'm going to very quickly, so please don't think SLE, serum sickness, Serum sickness, you know very well. And H4, this is very, very important. This is one confusing one. Heme is usually hypersensitivity pneumonitis. Hypersensitivity pneumonitis. A for, Orthus phenomena, Orthus reaction, R for rheumatoid arthritis. Here comes the rheumatoid arthritis. That's what I'm stressing. Okay, that's important. And P for post-streptococcal glomerulonephritis. Very, very important. And also pan-polyarthritis nodosa also is there. Okay, don't forget rheumatoid arthritis. Even your reactive arthritis also will come here. Orthus phenomena. Metal because Mycobacterium, TB, lepra. We already told lepra. Type 2. Type 2, no? 3 plus 2 is equal to 5. That's what you're putting here. Okay. That's And then other one is your hypersensitivity, type 4. 4, very rare diseases, something your sarcoidosis, your this thing, multiple sclerosis, Crohn's disease, diabetes mellitus, all these things will come here with that. Another any poison, nickel, IV poison will come. And important tests are here. Here, Cassoni test we told. Here, see your lepromin test, tuberculin, lepromin, tuberculin, free test. One more is Montenegro. Montenegro test. So everything is there important. So please, you can have one question. So this is a delayed hyper. The type 4 is the delayed hypersensitivity reaction. Rest all are earlier. Okay, only this is a delayed cellular. Rest all are immunoglobulin mediated. Okay, that I'm not going to stress now here. Yes, isograft and allograft. Here you had amograft, many graft, autograft, allograft. Autograft is from the same body. Allograft is from the uh, different person. Allo is different person of same species. Same species. So most grafts are allo only. Most grafts are allograft. That means kidney, bone, etc., etc. Kidney, bone, etc., etc. Okay, that is for allograft. Iso means twins, sharing the graft between the twins. That is isograft. Okay, identical twins. I for I, so identical twins should be there. Identical twins. That's all. Okay. Yes. Hyperacute, yes, hyperacute is which, yes, we already spoke. Hyperacute is just I told you, it's just type 2. Rest all graft rejections are type 4. Rest all they come under type 4. And even the acute graft rejection, sometimes it's 2, sometimes it's they say 4. So you stick only hyperacute means only 2, type 2. That's all. Okay. Larva currents, erupting erection, hyperinfection, this type of word comes. So this should be someone who is strong, who has this much current like movement. Hyperinfection means strong. So strongyloides. Strongyloides, stercoralis. Stercoralis, barefoot, no, like a barefoot, like hookworms, it goes. And main thing is again, don't forget, this is the only one, there is parthenogenesis. That means only female worm, no need male, only female one direct without fertilization lays the egg. Okay, only female lays egg without fertilization. So without fertilization. Okay, that is parthenogenesis. And also the egg immediately hatches as a larva only. Okay, that's also. So all these features will go only for your strongyloides. Parthenogenesis and larva immediately hatches egg immediately. So all these things go for only strong strongyloides. Okay, that's what I'm stressing here. Now, cholangiocarcinoma, frequently asked questions, so no need to say. This is basically CC. So Clonorhynchus sinensis. Sometimes Opus ricus also, but usually Clonorhynchus sinensis commonly asked cholangiocarcinoma. Bladder cell carcinoma, that is basically your squamous S is there. So it is cystosoma hematobium. Cystosoma hematobium. Okay, that's it. T terminal is there, so that's one. Okay. Nasopharyngeal carcinoma, Epstein-Barr virus. Very clearly, we know a lot of all the Burkitt's lymphoma, Hodgkin, non-Hodgkin, all these things are EBV. Steeple cell is once and we forget, this comes in the para-influenza. Para-influenza. Acute epiglottitis, that is your Haemophilus influenza. X-ray sign, epiglottitis. So steeple sign is for para-influenza. Okay, don't forget. Okay, important. Acute bronchiolitis virus is basically in children, respiratory syncytial virus is the one that causes acute bronchiolitis. Okay, repeated. So HBEN of that's what. Whenever HBE antigen, we are talking about hepatitis B virus. E antigen means you should know there is always increased replication, increased virulence, and increased severity and increased pathogenicity. Everything is high here. Okay, pathogenicity. When already antibody is formed, all or less, all will go less, decrease. That's all. Okay. Window period. Window period means itself, you should know that is W, window is M. So it is IgM of HBC, HBC. That's it. This is the one. If you have anti-HBC, HBC core antigen antibody, IgM of HBC form, that will be the this thing. Okay. A window W looks like M. So remember that is for window period of HBV infection. Okay. HIF infection, which all you know, it's a CD4 cell, but especially we are talking about CXCR receptor. Okay. CXCR4. Yes, CXCR4 receptor. Very, very important. In macrophage, it is 5. Okay, but here CXCR4 receptor. Okay. Yes, Kanagawa. We always say Kanaga was a recent asked question. Kanaga means she's a friend of V Paru. Okay, V Paru, V Para or V Paru. That's basically Vibrio parahemolyticus. Vibrio parahemolyticus. So basically, what happened? This is usually it is causing food poisoning due to seafoods. Seafood. Okay, seafood. So what happened? You have to increase the blood agar. You have to increase the salt concentration. Blood agar increase salt concentration. That is called Vagatsuma. Vagatsuma blood agar. So in that agar, this Vibrio parametrics will grow well. That's all. Okay, so because the halophilic, it's an halophilic organism. Okay, so that's all. So we are done. So this is a maximum short, frequently asked question I taken. Image based I haven't added because that's separate videos I've made. It's around 3 hours. If you have time, you go through it. Okay, fast. This PDF file is there. You can check it out. And for this also PDF will be provided. But yes, in this short time, this is some of the things that you know. I hope that you will not forget. You have to keep in your mind. Okay, that's all. Thank you once again. So do well. All the best. I'm expecting good news from all of you. God bless. Take care.